turn onto his side on 3. 1, 2, 3. Good. Swap hands from the top, please, first. One at a time.
In hospitals across the UK, nurses and doctors and NHS staff are fighting to save lives on the COVID-19 front line. Last month, in January, hospitals saw the number of patients with coronavirus hit a peak of almost 40,000. Hundreds of sick patients have been admitted every day. Hospitals have been overrun and staff stretched to their limits and beyond.
I'll tell you top for you.
As Britain's death toll passed 100,000, The Independent went inside one of 4 intensive care units at Northwick Park Hospital, where the sickest fight for survival. It declared a major incident in 2020 and has been overwhelmed ever since. Wards across the hospital are full with COVID patients. Operations have been cancelled. Normal services have been put largely on hold.
It's really upsetting, it's really sad, and after all this time, people cannot believe what is actually going on. But when you actually come inside of the hospital, the unit, push the doors, is all happening. It's like we're going out to war.
In intensive care, where the sickest patients are treated, teams work night and day to support the patients' bodies, buying each of them what the clinicians will hope will be just enough time for them to recover. The patients are paralysed and unconscious. They're entirely dependent on the skilled nurses to keep them alive. It doesn't get more serious than this. They're turned and laying prone or on their front because it helps their COVID-ravaged lungs to breathe a little easier.
Eyes taped and lubricated.
It's a difficult, risky process, taking 6 or more staff to turn each patient. And it can go wrong. These are life and death moments playing out on wards across the country.
It's quite incredible to see the effect that this virus is having on people whose bodies are ravaged and being kept alive by a myriad of machines and the skill of the nurses and doctors here at Northwick Park Hospital. They're working for hours at a time, shift after shift in this get-up. It's very hot, it's very uncomfortable, it's really difficult to kind of hear and understand each other. I can't imagine what it's like to be here day after day for 12 hours looking after patients.
We're in a converted medical ward that's been transformed into intensive care. There are 30 patients here, all fighting for their lives against coronavirus. They're young and old, men and women, black and white.
Critical care is full right now. We have a lot of patients who are very unwell. There are no discrimination for age. It's affecting everyone. They need to listen to the public sort of messages out there. They need to stay vigilant. They need to keep their distances, wear their masks, and look after themselves, because they may be the next ones who are affected.
Like many hospitals across the UK, extra wards have been created for critical care patients like these. Specialist nurses normally look after one patient, so demanding and extensive are their needs. At times during the crisis, the staffing levels have been so stretched, nurses have been caring for 3, even 4 patients. The only way this has been possible is thanks to redeployed staff from other parts of the NHS who have been brought in to help their ICU colleagues.
We haven't completely stopped all of our other commitments, and so we're still contributing to that, but we, in addition to that, come and do these shifts on days that we would otherwise have off or spare or whatever. It's what you'd expect it to be. Long days, slightly difficult work in the sense that it's emotionally quite hard and physically sometimes quite hard. And everyone is just trying to get on with it as best they can.
The work is relentless. For every patient discharged, more come every day. The virus shows no mercy. Not all of these patients will survive. Despite the round-the-clock care they're being given, the tragic reality is maybe 30, even 40% of ITU patients won't survive. Those that do face a long, hard road to recovery, and not everyone will bounce back the way they were before. It's almost 12 months since Northwick Park Hospital saw the first signs of the crisis that swept the UK and overwhelmed the NHS. What we have seen is the teamwork and dedication of all the staff, the clinicians as well as the cleaners, porters and managers who have all pitched in. But it will come at a price. Some of the staff have seen things they were never trained for. Every COVID survivor is celebrated, but the horror of what has passed on these wards will mark those who fought it for months and years to come.
Well, we know there's been a huge psychological impact right from the beginning. It's not just the amount of work, but working differently, dealing with a disease that we hadn't seen or heard of before the beginning of last year. Everyone's come through it, adapting and coping and expanding, but it's obviously been a huge amount of stress for everyone.
I'll be inhumane to think that I can walk out the door and the unit stops and my responsibility stops. I think me, like many other managers within the trust, do sort of caring is part of our lives.
Okay, so I've just come out of the intensive care unit. As you can see, I've taken off my hood and gloves. I've washed my hands. I'm hot and sweaty, and I've only spent maybe an hour or two in the department. I can't imagine how they do this every day, and it's going to stay with me for a long time.
Many of the nurses and doctors are exhausted. They will need to be cared for in the future. Yet even as the numbers of patients in hospital wards begins to fall and the vaccinations continue apace, the impact of coronavirus on other parts of the health service and the patients whose operations and care has been delayed are beginning to emerge. More than 200,000 patients have waited more than a year for routine treatment. The thousands of people affected by the mysterious effects of long COVID may need an entire new branch of healthcare to be set up, so vast could be the numbers. As the immediate danger from COVID hopefully begins to pass in the months ahead, very serious questions remain for policymakers and government over how they can best support the NHS to rise up again to meet the post-COVID challenge, a challenge that could be even greater than the virus itself.